Okay, let's talk about something that affects millions and millions of women, but is so often just met with silence. I'm talking about painful sex after childbirth and during menopause. It's a really personal issue, and in this explainer, we're going to break it all down. Because, just understanding the problem is the very first step toward finding a solution. So let's just start with the question that so many women ask themselves, usually in private. Is this just my new normal? Is this something I just have to live with now? It's a completely valid question, but I think the answer is going to surprise you. And the answer is a huge, resounding no. I mean, just look at the numbers here. We're talking about 37% of new moms who are still having pain 6 months after giving birth, and about 40% of women in menopause reporting the exact same thing. This is not some rare problem. It's a really widespread medical condition. So if you're going through this, believe me, you are so far from being alone. All right, let's start with what happens after having a baby. There's this kind of common idea that once you get that 6-week checkup, everything should just snap back to normal. But for so many women, that's just not the reality at all. This timeline really shows how long this can stick around. At 6 weeks, yeah, a huge majority, 60%, find sex painful. But look how that number drops, but not to zero. Even a full year later, up to 31% of women are still dealing with it. And for 11%, it goes on for 2 whole years. This just proves this isn't an issue that always magically disappears on its own. So what's going on here? Well, it's a mix of things. You've got the physical trauma from the delivery itself, tears, episiotomies, that can leave sensitive scar tissue. Then hormones play a massive role, especially if you're breastfeeding, because low estrogen can cause some pretty serious vaginal dryness. And on top of all that, there's the body's natural defense mechanism. Pelvic floor muscles can get super tense, and psychologically, just the fear of pain can create this vicious cycle that is really hard to break. Okay, now let's switch gears and talk about another huge life stage, menopause. In this case, the main reason for the change is different, but the effect it has on intimacy can be just as big. And it really all comes down to the decline of one single key hormone. And this leads to a condition that actually has a medical name. It's called genitourinary syndrome of menopause, or GSM for short. This isn't just some vague feeling. It's a recognized syndrome that covers dryness, painful sex, and even urinary problems. And just look at that range. It affects anywhere from 27% to a staggering 84% of women. Having a name for it is so important because it validates what you're feeling. And here is something that is so important to understand. Unlike hot flushes, which usually get better over time, the symptoms of GSM almost always get worse if you don't treat them. This is not something you can just wait out. The actual tissues will continue to change without some kind of intervention. So, to kind of put it all together, let's compare them side by side. Postpartum pain, that often comes from physical trauma and hormonal changes that are temporary. Menopausal pain, on the other hand, is driven by a permanent drop in estrogen. That's what leads to the thinning and the loss of elasticity in the vaginal tissues. The feeling might be similar, but what's happening inside your body is very different. Seeing how common this is, you have to wonder, why don't more women talk about it or get help? Well, a huge part of the problem is a few really powerful myths that create this culture of just suffering in silence. So let's just bust them one by one. First up is this idea of normalization. The belief that, well, because it happens to a lot of people, it must just be normal, something you have to put up with as part of being a woman. And the answer to that is just a hard no. Common does not equal normal. Think about it. Pain is your body's alarm system. It's a signal that something is wrong and it needs your attention. It is absolutely not a life sentence you just have to accept. All right, next up is the myth of just waiting it out. This hope that if you just give it enough time, the problem will sort of magically fix itself. But as we've already seen, that's just not how it works for most people. For so many, postpartum pain can last for years. And remember, menopausal symptoms usually get worse, not better, without treatment. So just waiting is not a good strategy here. And finally, there's this myth that this isn't a real medical problem. This feeling that your doctor has more important things to do and that you just be bothering them with something that's only about quality of life. Let me be crystal clear about this. You deserve care. Your sexual health and your well-being are a vital part of your overall health. Healthcare professionals are trained for this, they want to help you, and there are safe and really effective treatments out there. Okay, so we've busted the myths. Now for the most important part. What can you actually do about it? Let's talk about the path to recovery, because there absolutely is one. You can start with some really practical things right now. Use a good quality lubricant, something water or silicone based. Take more time for foreplay to help with natural arousal. Try out some different positions where you're in control of the depth and the pace. And for just daily comfort, you can use non-hormonal vaginal moisturizers a few times a week. These steps alone can make a huge difference right away. And when you're ready to talk to a professional, there is a whole toolbox of options. For menopause, topical estrogen can be an absolute game changer. For both postpartum and menopause, pelvic floor physiotherapy can do wonders for scar tissue and muscle tension. Psychosexual therapy can help break that pain-fear cycle, and there are even other medical alternatives out there. And I really want to highlight this, especially for menopause. Local or topical estrogen therapy is really considered the gold standard. It works right on the vaginal tissues to bring back their health, their thickness, and their natural lubrication, with very little being absorbed into the rest of the body. It is a super effective and safe long-term solution. Wow, we've covered a lot of ground, from the causes to the myths and all the way to the solutions. But maybe it all comes down to this one final thought. What if the first step to getting that comfort and intimacy back isn't a prescription or a procedure, but just a conversation? With your partner, with a friend, or with a doctor. Starting that conversation, that is often the most powerful step you can possibly take.